This isn't your average business podcast, and he's not your average host. This is the James Altucher Show.
Okay, so we're talking about the Oura ring. Spell that as an O-U-R-A?
Yeah.
Okay.
Yeah.
And you're wearing one.
Yeah. So basically based on, it's collecting things like heart rate variability, temperature, resting heart rate, and even minute amount of perspiration around that. It can sort of detect all these elements. And so based on all these things, it starts to infer, it has a bit of an algorithm where it determines whether or not you're more stressed or less stressed. I guess when we are stressed, things happen to our heart rate, things happen to the temperature even of our skin. You know, they sort of go up and down, and then they've been able to basically, push that into some kind of algorithm that then punches out some kind of stress response.
And have you noticed that since you got the Oura ring, because now you measure your stress levels every day, have you become less stressed?
Yeah, it's really interesting. I do think it's helped because it does. I go back and I look at my day and I'm like, okay, that's interesting. I didn't really notice that I was stressed there, but was I? What was I doing? And it does sort of train you a little bit, particularly with sleep. So when you're asleep, you're not aware of all the things that are happening to you. You're not aware of all the things that you do before sleep that impact your sleep, right? And if you had drinks, if you had a late meal, if you slept late, all these things impact the quality of your sleep. And so it's really helped train me, because I want better quality sleep, because it's very important for health, ultimately, having that rest and restoration. So I would say, yeah, it's just sort of trains you, and having an active guide as to what happened during the day, the things that you did, your behaviors during the day that contributed to your stress response, and all these different vitals. It has this kind of cumulative effect that it kind of helps you act better over time.
I've been afraid to get one of these devices that track everything, because I'm afraid I'll just get obsessive about, how many steps did I walk? How much hours of quality sleep did I get? Is my heart okay? Am I too stressed? I'm afraid I'll just become like overly, the way people check their email all the time. I'm afraid I'll just check this all the time and get obsessed with the data. But maybe it's useful.
You know what? I think you're right, though. I do think about this sometimes. I used to check my email when I woke up. Now I check my sleep score. Like, I am pretty obsessed about it. But what I've talked to people who have had it for a long time, and they say, look, it's good to have for at least a couple of years, and then you've kind of gone through that training I just spoke about earlier. And then once you've done that, you don't necessarily need it as much. So then you can sort of put it away if you think you've gotten a bit too obsessed over it and you're tracking things a bit too closely. Because really the benefit is in that training. Once you've had the training, you know what happens when you eat late, when you drink, you know how your body works. So now you don't necessarily need all the detailed analytics every day.
All right, I'm going to get one. And the interesting thing is, and this is going to drive us to one of the topics I really want to talk to you about, is the data Oura, the company, must be accumulating is probably amazing in terms of training AI. So probably really figuring out the roots of stress and heart attacks and strokes and maybe other things like, if among the 1 million people who use our ring, the people who went down in income this year only got 6 hours of sleep, as opposed to the people who went up in income got 9 hours of sleep on average. So there's going to be all sorts of conclusions and data for that the AI is going to determine from this.
It's unreal. You're absolutely right. Actually, we were just talking about this earlier, but Oura's got so much data. I heard the CEO talk about this at a conference years ago. He was saying that they may be one of the best predictors of whether or not someone has COVID, just based on the signature of all these things that I just mentioned: heart rate variability, temperature, resting heart rate, and your sleep patterns. And yeah, it tells a story, right? And so now what they do they also are able to tell you your cardiology age, like your heart health age. How old is your heart compared to how old are you? That's interesting. The other thing that it does is it's now starting to tell you if it thinks you're going to get sick based on some of the AI response, in terms of being able to learn based on your data and other people's data, what, you know, and what happens to your vitals right before you get sick. So
Sure, because it has a
fascinating.
million people who have gotten sick at different points. And if you start showing characteristics like, oh, you just went down in steps per day, your sleep went down, your heart shows you probably are on a plane traveling because maybe that your heart changes there. So
Right.
you're going to get more likely to be exposed to some bad air. Who knows? Well, let me ask you, can you buy the data? Can you license the data?
I don't know. It's a really good question. I think you're right, though. That's probably their biggest, kind of asset as a company is that they've accumulated all this, sort of first party data, right? It's their device. They've collected all of this data, and they're likely looking for patterns and anomaly detection amongst all of it. So it's fascinating. I don't know if they'll ever open source it, but I know this is an area, this kind of activity tracking and biometric tracking that's really, really on the rise. The whole idea of our lives medically is that, we used to be checked out once in a while. Once in a while, we'd get a checkup. Once in a while, we'd get our vitals checked. And now we're getting into a world where we're going to be continuously monitored. And that continuous monitoring, that data becomes really valuable. And because, people have said, hey, my Apple Watch saved my life because it was able to predict that I have arrhythmia. And I was, so we're getting into that into that stage of life now where these things are starting to get, quite smart and quite continuous in sort of their evolution in terms of focusing on our data.
Yeah, and using the AI or even very sophisticated statistics to kind of make, and it's not just like we're looking at this as, well, okay, it's collecting healthcare data so we can make healthcare predictions, but maybe we can predict other things like, oh, the people with these health characteristics vote Democrat, people with these characteristics
Yeah,
Republican, or people with these characteristics are more likely to make a buy when they see an ad because they didn't get much sleep last night, and here's an ad for clothes, and somehow people who didn't get sleep who have these other characteristics need clothes.
totally. I think those data relationships could be really interesting. I saw on X the other day, someone had built an ETF of stocks based on CEOs that lift weights. Like they're avid, avidly into wellness. They lift weights. They and they're really dedicated to it. And it was like striking how much better than the S&P they'd performed as a group. Like,
I
that's interesting, right?
I believe it. About a year ago, I was competing in um, one of the various U.S. senior championships for chess, and somebody pointed out to me that the winners of there's like 3 or 4 tournaments that kind of are the championship for older people in the U.S. for chess. Someone pointed out to me that all the winners that year, you could tell, lifted weights. Like they had, even though it's chess is a game where you're just sitting down, you wouldn't think it's related to lifting weights. It does give you more stamina. It gives you more focus, and there's something to building muscles that is healthy.
Absolutely. We're our minds and our bodies are connected, and if we have a stronger body, I think we would have stronger minds. And also what happens is when you lift weights, you have better glucose control. We now know that glucose has a lot of insidious effects, not only in terms of our body, but also, also our brain. That we're starting to think that dementia and neurodegenerative diseases are a form of type 3 diabetes, right? We started to hear that a little bit. So lifting weights is a great way of glucose control because that our muscles soak up more of that glucose. So yeah, the moral of the story is you got to lift, especially as a man as you get older. If you don't use it, you lose it. You start to get sarcopenia, then you've got other risks. You fall down, and like early death. All this stuff, right?
I gotta start lifting weights. I have the weights are sitting right there. I'm looking at weights, but I just never touch them. Um, so Hamed Shahbazi, I want to talk about perhaps the most important topic of our lifetime, which is the role of AI in healthcare and how healthcare is going to change, not 15 years from now, but like in the next few months or year or 2 years, 3 years, like the whole world is going to be unrecognizable. And like people talk about AI with robots and self-driving. I don't care about that at all, but healthcare is going to 100% change. You're the founder of Well Health, co-founder of Healwell, which is spinned out of Well Health. These are both public companies, but Healwell is does a fascinating thing with AI and healthcare, which we'll talk about. But first off, you started out as an entrepreneur, classic story from nothing. Sold your first company, I think it was your first company, for $340 million to PayPal. What's the story? We're going to talk about healthcare and AI, but I just really want to know, how'd you become an entrepreneur?
Thanks for asking, and it's just I'm delighted to be with you. Love your show and your podcast. It's great to be here. Look, I love solving problems as an entrepreneur. I was always just curious about solving problems. I kind of consider myself to be a tech generalist. So the first place where I was applying technology to help improve processes and different businesses was in fintech, where we were trying to speed up payments, lower the latency of having them post to the back offices of different billers like utility and wireless billers. This was important because a lot of people were paying a lot of money for last minute bill payments, these emergency bill payments. And we sped that up, and we started to save consumers hundreds of millions of dollars because we were able to do that.
I don't understand. So what was it? What was it doing? So I'm a consumer.
So let's say you need to pay your utility bill or your car bill, and if you don't pay it today, you're literally going to get shut off. Like you've kind of blown through your due date and whatnot, and you would typically go to like a Western Union or a MoneyGram, and they would do like a money transfer for your bill payment, and they would charge you like $8, $10, $12 to do that. And we came along and we said, that's egregious. That's crazy. We should be able to competently post a payment to someone's back office, for a lot less than that. And we established links into the back office of lots of different billing companies.
So how would I make so let's say I'm past my grace period. The utility company has sent me 5 notices. I'm about to get my electricity shut off. A, how do I hear about your company as opposed to just going to Western Union like I always do? And B, what do I do?
We actually became an option for a lot of the billers. You could go to the biller's site directly. You could go to the convenience store. We actually had self-service automated kiosks spread around where you could actually put cash into those kiosks, and you could then, if you were underbanked, or let's say you were cash preferred, there was a bunch of these different ways that we could acquire the transaction, mainly outside of the bank channel. So that was the thing that we were focused on, is the low to moderate income demographic that was paying outside of the bank channel.
Take a quick break. If you like this episode, I'd really, really appreciate it. It means so much to me. Please share it with your friends and subscribe to the podcast. Email me at altucher@gmail.com and tell me why you subscribed. Thanks. So in 2003, one of the first articles I ever wrote about stocks and finance, I called it, in retrospect, the name maybe is not so good, but I called it the poverty index. And I recommended, because there was a recession, it was 2002, there was a bear market, a recession was happening. And I recommended like dollar stores, rent-a-furniture stores, pawn shops, and payday lender stocks. And those stocks actually did do very well, and they were good businesses. Because, like you say, the underbanked, when you're banked, you don't understand that there are actually a large percentage of the population that don't even have bank accounts or right. Bank accounts they can regularly use because they're expensive. There's all these fees. So services for the underbanked do very well. And because they're local and community based, it's surprising how few people default on, like, let's say, rent-a-furniture situations or payday loans and so on.
Yeah, absolutely. And it's expensive to be poor, unfortunately, right? And so it's sort of counterintuitive. I should have access to cheaper services because I don't have as much money. But no, I actually have to pay more just to expedite a payment. And so And so this issue of accessibility and technology is a really big thing. And this is what we've tried to do at Well Health, is to try to give that higher end experience to just normal primary care visitors, that, allow them not to have to come in and sit for, a couple hours for their, doctor to show up, to be able to respect their time through digital technologies, allow them to book online, allow them to, feed information into the clinic to save them time, allow them to check in on their mobile phone. So we've developed all this digital patient engagement to help patients and clinics interact with each other. And then we've applied that to an enormous owned and operated network. So we're the largest owner operator of outpatient medical clinics in Canada, and we own a significant number in the US as well. So overall, Well's about $1 billion in revenue this year. Very profitable, 130 million in EBITDA is likely what we'll get to, generating pretty significant cash flow. And we're doing millions of patient visits, and a lot. And our worldview is tech-enabled healthcare. It's incredibly important to us. We're not just out there just trying to be an owner-operator. We really want to be as tech-enabled as possible, so we respect people's time and deliver a better experience.
So, and I want to talk about Well Health, your clinics, but also Healwell, which is you also, as we were talking about with the Oura Ring, you have millions and millions of patient records that you've been able to create an AI model on. And I want to talk about how this is gonna literally change the future. But I still am fascinated. How did you start your first company? Like, what was the transformation that took you from, whatever, to entrepreneur, to successful entrepreneur?
Thank you. Well, I think it was just, I think as an entrepreneur, you have to have a bit of audacity to think you can make a difference.
But what was happening in your life? Like, what were you doing?
It's interesting. This was really right out of school for me. I had just finished my engineering degree, and I did engineering because growing up in a Persian family, I was sort of given the choice of being a doctor or being an engineer, and my dad was an engineer. So once I finished engineering, I loved it. It was very interesting, but I just really realized that I don't want to be an engineer. I realized that I want to be a businessman, and so it was around the time when we started to see really the rise of, the graphical internet. And I just knew that I really wanted to be part of that, growth. I wanted to be involved in, this is before iPhones. I'm not in my 20s or 30s anymore. Right. So, and I could just see that the internet was going to disrupt everything. And so, it became a really big priority for me to get involved in this technology revolution and apply, the digitization and modernization theme to different businesses. And that's really what I've done all my life now. I've applied it to fintech. I'm now applying it to healthcare. It was remarkable that I even had the chance to do that with healthcare. It just goes to show you how much lag there is in adoption of digital technology,
particularly with healthcare. Like healthcare, I feel is 30 years behind the times.
100%. And so, in 2017, 2018, around the time that I'd sold my previous business, I remember having these experiences in doctor's offices, and I was thinking, this is unreal. Like, I could have had the same experience 10, 20, 30 years ago. The doctor came in, was handed his, paper folder, and he wrote paper notes. And I got a paper, kind of referral that I had to then use to call someone else with the phone. And it's just like everything about it was not digital. It took forever for me to get in. There were people running around everywhere in the clinic. It didn't look very organized. And I was like, I wonder if this is like an anomalous situation, or is this the state of play in healthcare? And so I started to do some research, and I was just floored. And at that time, in Canada, we had 0.25% penetration in telehealth throughout the country, which is unreal. It's really, really low at a time when.
How do you define telehealth?
Telehealth is patient physician consultation that occurs in any other format rather than an in-person consultation. So it could be over the phone, it could be an audio-visual kind of link like this. And 16, 17, we've got iPhones everywhere all over the world. And so the idea that there wouldn't be, video calls are commonplace, but they had not really made their way into healthcare. Some of the different HMOs were doing this, like Kaiser Permanente in the US had already quite a bit of growth in telehealth and whatnot. But as a country here in Canada, we were quite low. And just for contrast purposes, 2 years later during the pandemic, because of physical distancing, we got to a high of 80% penetration in telehealth. So 80% of all visits were attributable to telehealth and 20% will not. And now post-pandemic, we're back down, but we're not back down to the same levels we were before. Pretty much in all industrialized countries, we're in that 40 to 50% range. So forever, this industry's now changed as a result of the pandemic. You can't say that about too many industries where forever they're changed. Now there's an entrenched kind of behavior and preference to see physicians online for certain types of appointments. That could be mental health. It could be, chronic disease check-ins. It could be for prescription renewals, all that kind of stuff.
Yeah. And it seems like, well, first off, it seems like the general trend for humanity is we don't ever want to leave our house. Like right now I can get a chef to cook me food and somebody else will then pick up that food, deliver it to me, and then I can watch a newly released movie streaming right into my house. Like I just never have to go anywhere. And I can have a telehealth physician to, give me a prescription for something, and I can go out and get antidepressants and testosterone and whatever just delivered to me.
All delivered perfectly. Yeah. Yeah. So, and if you want someone to actually give you the shot, there are actually people now. There's all kinds of businesses across the country. They'll come over and they'll give you that B12 shot, or they'll administer the shot for you if you don't want to do it yourself.
Yeah, so right. I just applied for life insurance. So someone came here and took my blood and did all the blood tests, and then also I used to use I haven't used this lately, but the IV doctor where they come over and give you like vitamin C and whatever. I would do that before traveling, but also with telehealth now you have more opportunities to collect digital records, right? So like what sorts of data did you, once you were having millions of patients do telehealth with your clinics, what sorts of data did you start to collect?
Yeah. So I'm really glad you brought that up because, thematically speaking, electronic medical records have been around for a while. And while there has been, less usage in the past, that's growing tremendously. And for a long time, doctors have been, entering in all this data, right? Entering in their observations of the patient, what they're dealing with, what the assessment of the visit is, what the care plan is, what drugs they're taking, whether or not they're working, all this kind of stuff. All this information is going into the patient record. And, if you're seeing a specialist or you're getting labs done on your blood, all that stuff is coming into the primary care, record. And the problem is all this information has been going in and very little value has been coming out. And this is where our partnership with Healwell, our spin out of our data into Healwell has been tremendous because we now have, physician co-pilots, like AI co-pilots. What is AI really good at? Taking a vast amount of information, very complex, very complicated, and being able to actually create very simple insights and be able to deliver those to people at the right time and generate those insights based on that kind of anomaly detection and learning from data.
What's an example?
There may be a certain pattern, a certain signature to a certain disease. Like let's say, how your blood tests come back, the types of vitals that you exhibit, in terms of your enzyme levels or whether or not you're prone to diabetes or your BMI, all this kind of stuff could inform the view that maybe you have, some kind of, diabetes or chronic kidney disease or anything like that. And maybe the doctor hasn't picked that up because they have not been able to review all the information. There's so much information in the patient record. It's really hard for the doctor to go in and connect the dots and integrate the information on the fly, especially when you consider that here in Canada, doctors are getting paid 30, $40 for a primary care visit. In the US, it's not that much more, right? So it's a lot of work to do for a little bit of money. And so so basically this software will what we call risk stratify the patient for particular diseases. It'll say, hey, these are the patients that are red, yellow, green. They're at risk for heart disease. They're at risk for diabetes. They're at risk for chronic kidney disease. Or like they're red, meaning like.
I'm sorry, I keep interrupting. I know I'm going to get complaints later from listeners that you interrupt too much, but I just I get curious about, is the problem that, like, I feel like when I get a blood test, and I've barely in my life, I haven't been to a doctor's visit since I was like 18 years old. So, and I get a lot of criticism for this from my wife in particular. But is the problem because when you get a blood test, okay, here's my liver counts, here's my enzyme counts, here's this thing, that thing. And the doctors just look at one thing at a time and say, oh, these high liver counts mean liver disease. Is the problem that they're just looking at one thing means this, another thing means this, and they're not looking at all of how the different pieces of data interact with each other, and maybe a slightly elevated count in this area is related to a slightly elevated count in this area. It could mean some cancer or some other horrific disease that you have, but most doctors don't know all these correlated relationships, but AI does.
You're absolutely right on. Exactly. So
like, what's an example of that though? And I'm sorry, I just trying to understand.
Yeah. I think it's a lot of those. I think part of it is observational things that the doctor will write over time, and so there's a longitudinal element here. There's a timeline element here. So the AI will review all the different clinical notes, and this is what's AI is really good at. It's actually taking unstructured information and making it structured. So imagine all these various notes that are just sitting in the record over time. And it'd be hard to go in and read all of them. They could be, thousands of pages of PDF, but a machine can do that fairly quickly, right? And so it can look at, those doctors' observations over time, what your BMI was, what these results were like, and it can piece together, a story. It's like, oh, look, it's not just what happened at this blood test. It's what happened to all those blood tests that occurred over the last, several years, and all the different, observations the physician had, based on this. It could mean that you have a rare disease. And rare diseases are interesting because there are literally thousands of rare diseases and ultra rare diseases. This is a $200 billion market for pharmaceutical companies. A lot of those rare diseases have pharmaceutical interventions. And some, like in Canada here, there's some rare diseases where you'll have 3 or 4 customers, patients that become customers for particular pharmaceutical interventions. But it's really hard to actually identify whether or not someone is is subject or has exposure to some kind of rare disease.
So what's a story / disease where prior to AI, nobody would have, or it would have been very difficult to figure this out? After AI, this is a specific example. Like, do you have a story of a patient where they had symptoms over years, but weren't getting diagnosed correctly, and then suddenly AI, and boom, they're diagnosed?
Yeah, I mean, we have tons of those. I mean, I probably couldn't rattle off specific ones, but I've heard tons of these types of stories, and we all know someone who hasn't been feeling well for a while, and no one can quite put the mark on what's going on with them. And they're like, I've had so many tests, and I've talked to so many people, and no one's been able to figure it out. And I've gone from person to person to person. And it's because a lot of the times it is some form of rare or ultra rare disease. And we now support hundreds of them through the Healwell technology. There are hundreds of these diseases that our Copilot supports and can identify. And that's extremely valuable for a physician. But the most common diseases are chronic care diseases. So we've seen this a lot. We've seen people that are degrading, and good things are not happening. Even if they're identified for a particular disease, like let's call it chronic kidney disease, if they're under dosed in terms of the pharmaceutical interventions that they're taking. We've had a particular case I was looking at the other day. This particular patient was not doing well, and the co-pilot identified that they're not taking the right dosage. So it's just something simple as that changed this patient's life forever, because now they're taking the right dosage, and they started to improve right away.
What did the doctor say? Oh, if you're not feeling well, but we think we got the diagnosis right, it's got to be the dosage. Why did the AI have an advantage over the doctor?
Because it was able to kind of look at the data and recommend a particular dosage, and for the particular progression that disease had with that person, the dosage should have been much higher. And these pharmaceutical interventions are sometimes just useless if you don't have the right dosage. Like, you might as well not even be taking it, right? And so dosage and adherence are incredibly important in terms of beating back whatever ailment that you have.
So, okay, how did you train the AI? So you have millions and millions of patient records, starting from, let's say, the initial phone call. I've got a stomach ache. I've got a headache. Then you have a doctor's visit. A doctor takes all the notes. Then you have the next visit, the next visit, the next visit. You have all these millions of records. Just tell me technically, how did you train the AI? Like, what did you do?
It's not easy. So because of the complexity of the human body, you have to go disease by disease, and you have to do a really deep dive. You have to kind of bring on specialists and experts in that particular field. You need to look at tons and tons of data. You need to identify essentially what the signature of that disease is. Like it is characterized by certain types of labs, certain types of progression in terms of the degradation of certain vitals that could be showing up. So some of that could be rules based. Like, it doesn't have to be AI, but what's interesting about AI is just the ability to take unstructured information and structure it. That's really hard to do, because most of the information in the patient record isn't just perfectly laid out in tables. That's what we call structured information. You can run a search, easily it comes back, but the vast majority of information isn't there. It's unstructured. So an AI has to read that, whatever was written there, and try to interpret, what did it actually mean? What was intended by the physician that wrote this in context with everything else? That's where it gets really exciting, because it structures it, and then it can do anomaly detection. It can say, oh, based on all this information, now we know that we are actually pretty close to this particular disease. And this is what rules-based doesn't do, because rules-based requires you to perfectly hit on those criteria. If this,
right. If there's 10 variables, there's like 10 to the 10th number of possible variations of those variables and conclusions. So obviously this AI was trained on data. So you have millions of records where you have years of patient record, millions of patients where you have years of records, and at the end of the day, there is a diagnosis that the doctors agree on. You have this training data. How did you then feed it into an AI? Like, how did you build the AI?
It's really so what the AI is doing here is basically processing all of this data and learning. So a lot of times you're basically writing algorithms that allow the AI to just review the data, process it, learn from it, and identify the anomalies. And as you find the anomalies, you start to build software around these anomalies mean certain things. And a lot of times, machine learning is essentially trying to find out something based on this data that you don't know about. A rules-based filter, you're looking for something, you say, if this and this and this are true, tell me what the output is. In machine learning, you don't know. You say, tell me what the needle in the haystack is. Find me the needle in the haystack. That's what machine learning is good at. And when you do that enough times, and this is why you need so much data, if you do that enough times, you start to correlate relationships. You start to say, oh, we found the needle in the haystack this many times. in this data, it means that we have now identified a real pattern. And it's that pattern detection that AI is so good at. Does that make any sense?
Yeah, and so that's where the kind of supervised learning first takes place, right? So you had all these patients with all these diagnoses, they're in a big system, and then this system sort of figures out all the possible contexts that are related to each disease. And now, given a new patient record, it then basically spits back, oh, and you don't even know which patients it's looked at, which patients it's correlated to. But it figures it out and it spits back, okay, this person might be at risk for this rare disease.
Right. Yeah. And the process that I was talking about, and you touched on too, is about training the data. So once you train the AI, so the AI starts to understand certain things, then it becomes a lot more useful in being able to, respond to queries and make that data a lot more useful. And then there's basically two forms of AI. There's symbolic AI, and then there's generative AI. What's interesting about generative AI is that it's literally predicting what the answer is going to be based on this enormous amount of data. And so one of the things that we've done with one of our co-pilots is actually having the co-pilot, the service, actually listen to a patient and provider conversation, and taking all of that conversation and generating a medically relevant note. This has been a huge game changer for physicians, because typically physicians will have to take a transcript of the entire meeting, of the entire consultation, and they'll have to actually make that note. That note has regulatory relevance. Typically, that's how you get paid as a physician. You need to make that note into the record, and that note has a particular structure. It can't be a super long note. It has to be fairly short, and it sort of talks about the situation, what the assessment is, what the care plan is moving forward. And so doctors spend, a good part of their day just generating this note, right? And this is why they're taking all these notes and transcripts while you're speaking. So we found that's returning 20 to 30% of a physician's day back to them just by generating this note. So that's pretty incredible. So we're already starting to see, back to your comment earlier, that physicians are starting to change, not 2, 5, 10 years from now. Now AI is starting to impact them. They're starting to get
in real time. Could the AI make a diagnosis while the patient and the doctor are talking?
It can, right? It can start to take that information that's just taken into the generative AI as it's generating, and it can start to identify things about it. And especially it's powerful if it's connected to the rest of the record. So then it could say, based on this visit and based on the patient record, we recommend a referral, or we believe that there's the assessment of the chart now is that this person should go see a specialist, or this person should try this pharmaceutical intervention. So yeah. I mean, all of it's connected, and that's where we're going. Basically, we're going in a direction where physicians are going to get a lot more help. I think they've been very expensive data entry clerks for many years, entering data, into these patient records, into these EHRs, and not getting much back. And now we're starting to see AI-driven co-pilots actually be able to, pull all these patterns together and identify these kind of simple insights that help physicians now, move things forward. It's like, think about a plane and a pilot. You get into a plane and you fly and you don't even think anything about it. But the onboard computer is doing everything. But you still probably would not fly unless that pilot got into the plane, right? We feel much better that there's a pilot there. I think this is where healthcare is going. You're going to have these co-pilots, all this machinery and intelligence that helps the physician make a good decision. But for the most part, a lot of the hard work is going to be done by machines in the future. And that sounds a little much, but when you consider the fact that a human body has far more complexity than a Boeing 747, there's no way a pilot could run those planes properly without onboard computers. So how are they delivering patient visits, right?
Like, let's say I'm a patient, and let's say Some days I have stomach aches. Some days I have migraines. Some days I'm a little bit more fatigued than others. And I go to a doctor. They might say something like, well, when you have a stomach ache, take this Pepto-Bismol. And when you have a headache, take Excedrin. And when you're fatigued, take, melatonin. But you're saying I could go in, and given my prior records and given the conversation I'm having with the doctor, the AI can say, no, you have this kidney problem, this rare kidney problem, and you need to see a specialist right now. So that's the sort of
Exactly.
leap that could happen, where the doctor is just not going to make the connection. Oh, stomach aches, headaches, fatigue on different days, extremely rare kidney disease. The doctor might not make that connection because he's never encountered it before, but the AI, among its millions of records, has encountered it maybe many times.
Correct. Yeah, I mean, a lot of what you see when you go to a walk-in clinic or some kind of urgent care center is basically a physician treating your symptoms. It's like, okay, I'm sorry you're feeling that way. Here are a bunch of things that you could do, but there may be something going on. And from a preventative health, this is all about preventative health. Like if we can identify the issue earlier, time in medicine is everything, right? So if you're not feeling well, if you've got a pain somewhere, listen to it. Don't ever suppress that, because pain is a signal. These are all these things that happen in your body are signals, and you need to pay attention. You need to be aware, right? And so, and what we're doing with AI is we're just getting time, and that's giving us really precious opportunity to intervene before things get worse.
Do you have a sense of what percentage of the time the AI makes a recommendation that's correct versus incorrect?
Oh, it's a good question. The vast majority of the time, it's got a point. Now, sometimes the doctor could know, so it could just sort of dismiss the notification or what have you. Sometimes the AI due to a lack of information, it may not make the right recommendations, but that's also in the quality of the AI. So if it doesn't have enough information, it shouldn't make a call. So we've sort of seen a little bit of that. Is that it doesn't always have to give an output. It should give an output when it feels quite certain, based on all the things that it needs to see in terms of pattern detection. So that does get to quality of AI. But I would say that with the type of copilots that we're building and that we see, there's a lot of rigor and discipline and quality that goes into the stuff. I would say it's sort of rarely wrong. It's probably going to be right 95+% of the time, or it have some kind of point to make. So you'd have to review those notifications as a doctor and try to understand why it's making those inferences.
Are we getting to a point where we can even do, or you could implement healthcare as a service? So I could log on to Healwell and say, oh, I have stomach aches today. And then tomorrow I could log in and say, oh, I had a migraine today and I took Excedrin. And then the next day, I slept 14 hours for some reason. And then it comes back and says, look, you need to see this doctor. He's available right now. I'm going to make the call for you. And boom. Like, so the whole, HAAS, HAAS, healthcare as a service.
Absolutely. Yeah, no, I think that in the future, you're going to have a lot of intelligent questionnaires, AI that asks you a bunch of questions and basically going through a chat. And then it'll get to a point where it says, I'm going to tee up a conversation for you right now with someone who can address this one point or talk to you about the situation. And the beautiful thing about that is that as soon as you speak to that person, it's already delivered kind of the assessment and all the notes required for that person to understand exactly the situation and where they can start to make a valuable contribution.
Because I feel like now there are simple versions of that, but it's very rule based. Like, let's say it's specifically about sleep. Like, how many hours on average do you sleep a night? Oh, okay, you probably need this drug. Boom. So it's like very rule based.
Totally.
But if it's based on like the AI of understanding the data of millions of patients paired with their diagnoses, and then comparing my specific language and context to the AI database, it seems like that's very powerful.
Yeah, I mean, look, I think the more history you have, the better the AI is going to be. And what's interesting, it's not just about your data. See, a capable AI is doing this deep learning where it's comparing your data with all the other data that it's seen. So,
Right.
so part of this is about unlocking the value of your data, but in context with these greater data sets.
Well, how many patients' records do you have in the AI?
Oh, I mean, we have over 20 million patient records, just in our Canadian, in our Canadian business. So it's a pretty vast amount of patient record. I mean, it's terabytes of data.
So it's like a doctor, like a really smart doctor with perfect memory on 20 million patients.
Yeah, exactly. I mean, it's hard to beat, right?
Jay, this could be, Jay, do you think we have like a good part one? And then we will do a part two where I would ask more about the specifics of healthcare AI and your companies and also more about entrepreneurship.
Sure.
But I think this idea of healthcare as a service will get people thinking, and I'm very excited about the future and what it brings. So thanks so much, Hamed, and we'll talk maybe not next week, but the week after. And Jay will help schedule something.